Hello students, today we'll be discussing about two slides. One is rhinosporidiosis and the other one will be clear cell renal carcinoma. So what is rhinosporidiosis? It's a chronic granulomatous disease caused by Rhinosporidium seeperi, which belongs to a class Mesomycetozoa. So it's a microorganism which lies between a fungi and an parasite. So, how is the mode of transmission? It is by bathing in stagnant ponds in which the animals also bathe, and hematogenous route and auto inoculation is very, very rare. So, grossly, so you can see these reddish polypoidal friable mucosal masses in the nasal cavity. Microscopically, they are characterized by sporangia, these large sporangias of varying size, which are located in the stroma of the polyp. And the overlying mucosa may show squamous metaplastic changes. And the largest of these are usually immediate subepithelial in location, which may or which may not show evidence of rupture. So in this picture, you're seeing a large sporangia with thick wall. So this is thick eosinophilic wall with plenty of endospores or sporangiospores. The sporangiospores are basophilic. So usually this is not ruptured when this whole sporangia is ruptured. It elicits a granulomatous reaction where you can see a lot of inflammatory cells, mixed inflammatory cells composed of lymphocytes, polymorphs, and plasma cells, and also giant cell reaction. And also, so this nasal polyp arises from the nasal cavity. So obviously you can see the nasal epithelium. So you can see here the squamous epithelium. So you can see the squamous epithelium here, and underlying and overlying you can see the the sporangia. It's sporangias, and here you can see the sporangias, and you can see tiny sporangias also. These are the developing sporangias. Sporangium. So this picture you can draw in your exam. You can draw the squamous epithelial lining. This is the respiratory epithelium with cilia, and there is some ulceration. So there is discontinuity of the epithelium here, and in between you can see the thick-walled sporangium of variable size. So this is the largest among these, and you can see the thick-walled sporangia filled with sporangiospores. So the epithelium overlying is stratified squamous epithelium. So this is a metaplastic epithelium due to the fungus infection. And then you can see the chronic inflammatory cells composed of lymphocytes, plasma cells. So these are all the basophilic cells are lymphocytes, and then these eccentrically placed nucleus cells are plasma cells and also macrophages, which has vacuolated cytoplasm. So when the sporangia gets ruptured, you can see the inflammatory reaction towards the um, inflammation. So here you can see the sporangia with thick-walled sporangium, basophilic sporangiospores. Here a plasma cell, macrophage, and these are the lymphocytes. Moving on to clear cell carcinoma. So clear cell renal cell carcinoma. So among the renal cell carcinomas, the clear cell is the most common type, and it is associated with a syndrome called as von Hippel-Lindau syndrome. So they are incidentally found in 60 to 80%, and metastasis is often through hematogenous route via renal veins to lungs, liver, bone, soft tissue, and adrenals. So what are the risk factors? So adult polycystic disease, smoking, obesity in women, hypertension, von Hippel-Lindau disease. So how is the gross appearance? So importantly, the most important gross appearance is the variegated appearance and the gray yellow color appearance. So what is variegated? Variegated means you can see a lot of colors, variation in the colors. So there will be yellow color, hemorrhagic, then tan color. So all varieties of colors will be seen in the gross image. And the tumor mass is orange to yellow in color. It is well circumscribed, hemorrhagic, necrotic, solid, and cystic. So why is this tumor yellow in color? It is due to the lipid accumulation inside the cell. So usually it is unifocal, so unilateral, or it may be unifocal or multifocal. So it can maybe in focally or multifocal. Frequently involvement of renal vein. So you can see the thrombosis, the metastasis through the renal vein, hematogenous spread, and renal sinus. Soft fleshy areas may herald sarcomatous component. It's usually unilateral, bilateral in only 1%. So this is a section, this is a gross picture showing a bivalve nephrectomy specimen which reveals a multiple golden yellow tumor nodules. So you can see the golden yellow tumor nodules here. So this is the kidney structure, this is the cortex, and this is the medulla. So you can see the golden yellow, well circumscribed nodular structure, and invasion of the renal vein and adverse prognostic indicator. So for the prognosis, the vein invasion is very important. So how is the histopathology picture? So histopathologically, you will see nest or solid or trabecular pattern of polygonal cells, usually with clear cytoplasm. So how is a cytoplasm? It is clear. So you should not write this as lipoma, because lipoma you don't see this much of blood vessels. So when the slide is focused, glomerulus will be focused for you to identify it as a renal tissue slide, and with a tumor in the renal tissue. So it may be eosinophilic in high-grade tumor, and the central nucleus and delicate branching vasculature. So this branching blood vessels, you call it as chicken wire appearance. So two important features are the polygonal clear cells with delicate fibrovascular um, fibrovasculature. So in this slide, I'm going to show you the renal cell carcinoma clear cell type. So here you can see a section from the kidney. So this is a section from the kidney showing the normal renal parenchyma and the fat present here. And in between you can see something different. So this is something different in this slide. So this is a well circumscribed nodule. You can see the well circumscribed nodule here, and also some areas of necrosis. So this is a tumor which is pushing the normal renal parenchyma. Let me zoom in. So it has a thin capsule, the tumor, and this is the fat you're seeing here. This side you can see the normal renal parenchyma. So how do you, now you may ask how do you say this is section from the renal parenchyma, renal tissue. So when you zoom in, you can see the nice glomerular structures and the tubules. These are the renal tubules and these are the glomerular structure. So when this slide is focused for your exams, it will be focused this way, where the normal renal glomerular tubules and glomerulus will be focused on one side, and the tumor with clear cells will be focused on the other side. So you can see the transition from the normal renal parenchyma here, and this is the tumor. So let me zoom in again and zoom out. So you can see the tumor here. Now let us see how the tumor appears. So the tumor is composed of polygonal cells with optically clear nucleus. So this is the very important feature in clear cell renal carcinoma. So you see optically clear nucleus. So you can see vacuolated cells. See the optically clear nucleus, that is no granules or anything, just has only a nucleus. So the how is the arrangement now? The arrangement will be an acinar pattern or tubular pattern or in nest pattern. So there are the appearance is in nest pattern, in tubules, and in acinar pattern. And also it may be in solid sheets. So the typical feature in renal cell carcinoma is the cells are polygonal in shape and there is alveolar like pattern. So I can see a lot of polygonal cells with optically clear nucleus, and a very important feature is this alveolar pattern is surrounded by thin, delicate, branching fibrovascular pattern. So you see fibrous tissue with vascular structures. So the tumor cells are surrounded by thin fibrous septae and vascular structures. You can see the RBCs here, right? So you can see the blood vessels and also the thin pink color the fibrous fibrovascular pattern. So these patterns is usually seen in low-grade areas and is considered to be the characteristic for the diagnosis of clear cell renal cell carcinoma. When we move on to this area, so here you can see this is the tumor here, and this is the renal parenchyma here. And there are also some inflammatory cells in between the stroma. So here you can see the renal tubules, that it's no tumor deposit here, only few lymphocytic infiltration with a few blood vessels and hemorrhage. So as I'm moving forward, here you can see the tumor cells with vacuolated cytoplasm. So this vacuole is due to lipid, so intracytoplasmic lipid. So that is why you see the cytoplasmic vacuolation here. So this whole area is full of hemorrhage. So the kidney, you can see solitary, well circumscribed lobulated mass, which is involving the renal cortex with characteristic golden yellow color. So this golden yellow color is imparted in the gross picture is due to this lipid, so intracytoplasmic lipid. So that is why you can see typically a renal cell carcinoma is yellow in color grossly. So when this slide is kept for your exams, you should pick up the diagnosis and write this as clear cell carcinoma of kidney.